let's visit our story. And universal healthcare workers have threatened to continue with their strike, paralyzing healthcare across various public facilities until they're all employed at a permanent and pensionable terms. The 8,571 workers were employed on contract basis by the government between 2019 and 2020 to boost manpower during the COVID-19 pandemic and were promised to be transitioned to permanent and pensionable terms. Now that has since been an empty promise, and they're now demanding a provision in the 2025-2026 budget for employment under permanent and pensionable terms. Laura spent the day with the UHC workers and filed this story for us.
Placards, whistles and vuvuzelas in hand, this universal healthcare workers stormed the Ministry of Health, making their way into the compound demanding audience with the Cabinet Secretary, Aden Duale. They say enough is enough, as 8,571 of them have been left in the cold. So far, at least 44 of their colleagues have died since their contracting in 2020.
These universal healthcare workers were employed during the COVID-19 pandemic on short-term contracts, and despite years of service, they have not been transitioned into permanent and pensionable, leading to disparities in pay and job security as compared to their counterparts.
Their key concerns: salary disparities and lack of healthcare benefits despite offering those very services.
Tunaambia Duale ya kwamba azoee hii kelele mpaka tupate PNP and gratitude. We have been talking about supplementary budget since 2023. How comes when it's to talk about UHC, you bring the issue of supplementary budget? We want to be in the major budget, which is next month.
The Ministry of Health says it has had a meeting with the Council of Governors, a section of union leaders and UHC representatives on 6th May 2025, and through a statement, the ministry says, and I quote, that they had agreed that the transition to county governments will be effective on the 1st of July 2025, when UHC staff will be transferred to county governments. UHC staff contracts will remain valid until May 2026. The transition of UHC staff to permanent and pensionable terms will be incorporated into the 2026-2027 fiscal year upon contract expiry. Gratuity for UHC staff will be processed upon contract expiry following guidance from the Public Service Commission. The unions are now accusing the Ministry of Health of lying about the set agreements.
The UHC comrades that are here today, they never went on strike because they wanted a transfer of their payroll to the county. That was not their reason. And that is why we are saying that we are not party to that agreement, because the agreement does not resolve the needs of the UHC workers.
It's either PNP and gratuity, or we are not going back to work.
This strike comes 3 months since Duale took over office from Dr. Deborah Baraza, promising healthcare workers and Kenyans at large to fix the mess in the health sector. Helen Aura, NTV.